Okay, all set? Good afternoon. Before I make some comments about some educations regarding our schools, I'd like to join the rest of the state in honoring two of our dedicated public servants who were laid to rest this week. State Trooper Justin Schaefer and Bothell Police Officer Jonathan Shoup. Both of these officers lost their lives in the line of duty while protecting us. The entire state honors them, and the entire state grieves for their families and with their families. If you listen to their personal stories, they are ones of dedication and commitment and professionalism, and they lost their lives protecting us. And we want their families to know that we would like to embrace them, and we thank them for their commitment to the state of Washington. Today, I'd like to provide you with our state's new recommendations from the State Department of Health regarding in-person instruction as it would begin this fall, for public and private K through 12 education. I'm joined today by Superintendent Chris Rakedahl, who has some remarks, and also Kathy Lofi of this Department of Health, who could stand for some of your questions. We know that the uncertainty regarding our schools is a subject of great anxiety for our parents, our families, and our educators. And that anxiety is not just about whether it's safe to go back to school or how to do so, but also about the impacts to children if they don't return to the classroom. We know that ultimately the most important thing for our children and their families is their health and safety, both to the students and to the relatives of these students who could potentially be infected because of this pandemic. The Department of Health and the Superintendent of Public Instruction have developed a framework we'll talk about today to help local health departments and local school districts decide how or whether to have on-site education in the classroom this fall. Now, unfortunately, as we've been talking about in the last few weeks, the rate of transmission of this virus is not low enough as we need it to be. The R0 number, that's the number of people that each person would infect, is still above 1. And the implications of this are vast. It means that this pandemic will continue to grow unless something changes to the positive side in the state of Washington. So our health experts are appropriately concerned about this. So am I, and I think anyone would be who has seen what happened in other states as this virus has exploded. And if every school district brought all of their students back for in-person instruction today, I believe we would see a real meaningful and dangerous increase in COVID activity. Now, we are chartering unknown and extremely challenging grounds, obviously, in our state and in our nation. We know this, where states or countries have tried to return back to the classroom, they essentially have all had less COVID activity in their communities than we are experiencing today. So recent school openings in Mississippi and Georgia have already seen disruption because of COVID outbreaks that immediately took off as soon as they returned to school. Israel, which had one of the lowest COVID transmission rates in the entire world, essentially lost control of the spread as it has swept through a number of their schools, requiring further school closures. And meanwhile, a recent study by public health experts in South Korea looked at COVID-19 transmission rates in the household by age groups. And they found that the 10 to 19-year-old age group spread COVID to their close contacts at rates at least similar to adults. So we know that the congregate settings of any nature, including schools, have the capacity to spread this virus. So as far as our recommendations, current circumstances still allow, in our view, flexibility in schools. So we are issuing recommendations today, not actually legally binding requirements or prohibitions. But they are strong recommendations, and they are based on science. They're based on the health of our children based on the sure experience that we are not going to allow our state to be hammered by this virus as other states and countries have been. So, here's what we have to say. When COVID-19 infection rates are high in a given area, we are strongly recommending that school districts move mostly online or remote learning modes. This framework also serves as a strong reminder that communities simply have to continue to do all the things we've been urging everyone to do. Use facial coverings, limit mobility, practice social distancing and good hygiene. We know these practices ultimately can bring down the COVID-19 infection, and they can help ensure our students get back into the classroom. Some of the best things we can do for our students right now is not to go to parties and not wear masks, not to have congregate settings inside with a lot of people or even a few people where this infection can spread. So I hope everyone can be part of this effort to ultimately create the conditions where we will not have to consider going to new systems of education of our students. So what we've done is we've looked at very closely for the last several weeks at the epidemiological data of our state. And our framework uses this data by county and is broken down into three categories for disease transmission. And it's measured by the incidence of new cases per 100,000 students or residents that occur in some over a 2-week period. So we've basically put counties into three categories: high risk, moderate risk, and low risk. Now, it should be noted at the outset, the moderate and high risk counties unfortunately represent 25 counties. And the vast, vast majority of Washingtonian students are in these two categories. You recall that a couple weeks ago, our health experts released a report reminding us something very, very important, and that is that our schools are not islands. They both are affected by what's going on outside in the schools, and they affect greatly what happens outside of the schools by what happens inside of the schools. What happens in the community has great impact in the schools, and what happens in the schools has great impact on the communities. So here's our recommendations. In areas that have high COVID activity, and that means when there are more than 75 new cases per 100,000 residents in some over a 14-day period, schools in those counties are strongly recommended to use distance learning, with the option for limited in-person instruction in smaller groups with students with the highest needs, such as students with disabilities. We also strongly recommend canceling or postponing all in-person extracurricular activities, including sports and performing arts. Second, in the moderate group, this describes counties where we're seeing cases in the range of 25 to 75 per 100,000. In these situations, we would recommend local leaders consider distance learning for most middle and high school students, with possible in-person learning options for elementary students and those with special needs. Now, these are the students who are most in need of in-person instruction, of course. We'd also recommend districts in these areas to cancel in-person extracurricular activities and consider low-risk activities when more students have returned to the classroom. And once again, we know this is challenging, but we believe these recommendations are fully supported by our love for our children, our understanding that they can cause infection in their families themselves, and the best science available to us. Finally, for the low-risk counties, right now there are just 5 counties where the rate of infection is less than 25 cases per 100,000 over a 2-week period. Now, this is the level we've set as essentially as a goal, and right now there's only 5 counties that meet that. These can be considered low risk, but we'd still initially recommend a hybrid model of in-person and distance learning for middle and high school students and full-time in-person learning for all elementary schools students. Now, we know whenever there's in-person instruction, school administrators and staff really need to ask themselves whether they can implement our state recommendation as well as the state health requirements for schools that were issued in June. And this is an important point. The Department of Health has issued requirements for opening of schools, and those are requirements. We've made recommendations, additional recommendations today, but those requirements still need to be met in any school. And that's very important because these are themselves very important to the health of our students. They're important to be able to protect staff and students at higher risk for COVID complications. They're important to maintain social distancing as well as personal hygiene and cleaning of disinfecting services. And these are just some of the considerations detailed in those recommendations, or excuse me, those requirements. So I want to also add that no matter the current rate of transmission in a given county, both school leaders and local public health leaders need to be prepared to monitor for and to respond to suspected and confirmed cases of COVID-19. Now, there's other concerns as well, obviously, and there are many. This is a challenge for all of us. We've got to ensure access to distance learning for students in rural or underserved areas where access to high-speed internet is a challenge. To help with that, we are making an investment of millions of dollars to help low-income families buy internet plans and address other technology needs. The superintendent will discuss that in more detail. We're also making an investment of millions of dollars to help in giving our educators additional training and how to perfect these remote learning systems. We've learned a lot last spring, but we want to help educators to continue to sharpen their skills to look at these new innovative models of how to provide remote learning. Now, we know there's other factors that impact student learning even before this pandemic. We already knew that K through 12 education works best for students when the system can adapt to what different students need in order to learn. And we know that this pandemic really does create unparalleled challenges in our efforts to meet the obligation to bring equity in education. But we ought not to be any less committed to provide equity throughout our educational experience for these students. It's the right thing to do. We ought to be dedicated to it. And our recommendations encourage districts to be as innovative as possible, and it does allow on-site learning for these students where there really is no additional opportunities. We've already seen other ways that COVID-19 is not equitable in those across the society, and we can't compound the inequity that's inherent in this disease by the inability to do the best job we can by these students with every tool at our disposal. So we'd like local leaders to work together to look at all modes of learning that are best suited to students with disability, students of color, English language learners, students from low-income households, homeless and foster youth. And we've learned much how to do that last spring, but we've got to continue to sharpen our skill set and broaden our access to these students. They need us, and we need to be there for them. With that, I'd like to turn this over to the superintendent, who'll talk more about the CARES Act and the like. And I want to thank him for the job he's done really trying to assimilate the different views across the state of Washington and the different circumstances. Chris.
Thank you, Governor Inslee. Chris Rakedahl here, State Superintendent. Really appreciate folks tuning in here to get an update on the guidance. I want to remind everyone that, as the Governor has indicated, our prior guidance that we issued in early June is very consistent with what has been presented here following the great work of the Department of Health. That guidance was about what you do once a student walks into a building or a staff or faculty member. Hand hygiene, regular cleaning of our facilities, daily screening, 6 feet of physical distancing, and face coverings. And that will still be an essential and mandatory part of any return to our buildings. What this does is it answers a question that now needs to be answered. Under what threshold, however, should districts and local health authorities be thinking about with respect to opening up facilities for learning in any sort of traditional way? When we issued our guidance, cases of COVID-19 in our state, hospitalizations, and sadly the death rate were all on a steep decline. Things were very, very good in our state. The leadership of Governor Inslee and taking early action gave us a great opportunity. What we have observed, however, since early June is certainly cases on the rise. And it has caused a lot of folks in the education system to make request of the governor and my office, but specifically the governor and Department of Health. What framework can you give us as we think about these contemplations to return fully in person, hybrid models, or to remain remote for the beginning of the year? That's what really prompted a lot of this. As the governor indicated, in other countries, most of them who did try school restarts had significantly lower infection rates than we observe today, certainly in the country and even in our state. And there's mixed results out there. We've been observing more than a dozen countries, some who have had moderate success in returns, and some, quite frankly, who returned too quickly, too fast. They did not have the proper elements in place and unfortunately have found themselves shutting down again. And that will not build confidence amongst families, and it will not be a successful and sustainable restart. The last thing I'll say on the front end of this is the business community deserves a huge thank you here, because part of what makes this possible is we now have a state rowing in the same direction. And their mask initiative statewide has had a big impact. Opening up the economy, opening up schools, opening up our communities is a function of our shared work. And we saw great impact to that, success to that. But together, we really have to figure out a more consistent behavior pattern of our teens. I've got two of them, a 14 and 16-year-old, and we work very hard every single day to make sure they understand that really physical distancing is ideal, and if they must be engaged with others, face coverings, frequent cleaning of their hands. And so just a big thank you to the state of Washington for the work that they're doing, we're doing, and there's work to be done still. To the specific training initiatives, we want to be really effective in remote learning. We were a leading state this spring in pushing through while other states couldn't quite kind of get off the ground. We pushed through for learning, but it was challenging in many places. We've put forward $2.5 million already for training. We issued that message last week. A huge thank you to the legislature and the governor's Office of Financial Management. That money will specifically focus on limited platforms that create consistency within a school district. What we saw last spring was schools shut down across the country and students went to do remote learning. And in some cases, 3 or 4 different teachers had 3 or 4 different learning management systems. And we intend to be more efficient and more effective about that with professional learning across the state. It's available to all of our educators, our certificated teachers or paraeducators and others. As the governor indicated, another over $8.5 million has been released. Thanks again to the legislature and the governor's office for their work here. Our goal here is to connect tens of thousands of free and reduced price lunch families who are in a serviceable area. So they're in an area that has connectivity, but due to their family's financial limitations, they've not been able to access that kind of technology connection, and therefore it really limits their ability to access their learning. This was another thing where we listened to families and listened to community, and they said, can you make this a priority? So we will roll this out here in the next couple of weeks with lots of providers. Many of our districts are already doing this in relationship with those providers. This is the use of Federal CARES Act money. It's one-time money. Folks should not rely on this long-term, but we can connect, again, tens of thousands of families who are free and reduced price lunch eligible, who do not currently have service, and we can provide that for the entire year. So this will be a year's worth of service for those families. Our schools will come into this environment, remote learning, with daily and weekly schedules for students, families, and educators. They're obviously been doing the training to get more efficient and effective at this. We will be taking attendance regularly. Grading practices are back. We are assessing student learning. We are a long ways ahead of where we were last spring when every state in the country shut down their schools to in-person learning. We've done a lot of work here to be ready for this. We expect this to be a better experience for families and students, for those communities who make the choice to go fully remote. But nothing about this is ideal, as the governor said. The best model we have built is one that is in person, that brings community supports in place, teaches kids amazing content that they learn from each other. They get nursing services, mental health supports, and all kinds of things. Our comprehensive in-person schools are really an amazing institution that underwrites our economy and our democracy. But we can't get to that right now if it is not safe for students and staff and their family members who are impacted by the presence of them in congregate settings. So this framework is very specific for each county to be working with their local school boards and school superintendents. The last thing I'll conclude with is a very clear understanding that many districts have already gotten to this decision because they've been working with their local health experts. And for many of them, they've said, okay, we've been listening to the science. We want a statewide framework, which the governor is delivering on here today. And then they've said, and we want some framework for when it's safe to come back. So this isn't just about not starting, but what does it mean if you start getting your cases down and we have real success this fall? What does it look like to begin a return? And I suspect Kathy will answer some of these questions, but what we observed in other countries for certain is you've got to get your case numbers down, and then you've got to have a slow return back. Perhaps it's your earliest learners first, small groups of students. Doing this in a way that is slow and strategic and allows us to monitor health conditions, and then obviously if contact tracing should be necessary, you can do that in a way that's effective. So thanks again to the governor, the Department of Health. This is a health framework consistent with what we've issued in June that should give districts a significant confidence on what it means to be low, medium, or high risk, and that should create a better partnership with their local health officials in making these determinations at the ground level. Thank you, Governor.
Thanks, Chris. I look forward to your questions.
First question comes from Sally with AD.
Hi there, this is Sally Hull from the Associated Press. There's a lot of anger in Seattle right now because they say they're going to require kids, even young kids, to be online 8 hours a day. And the district is saying that's up to the state because of the hours and days mandate. So is the state recommending that when you go remote, as you're recommending for most of the state, that it amounts to having kids online 8 hours a day?
Chris, you want to address that?
Set in law, 1,027 average hours for a comprehensive school district, kindergarten through 12th grade. That can be achieved in a lot of ways. As you can imagine, in a regular day, there are times when teachers are delivering instructions, sometimes students are working independently. Same here, it is not 8 hours of face time that is required on screen. Districts are designing that on their own. Sometimes it's 3 or 4 hours. They're trying to be very reasonable and responsible about the amount of screen time, but there could be additional assignments and additional work expectations of students, even when they're not synchronous with the teacher. So our State Department of Education, State Board of Ed, has established a pretty flexible framework for what an instructional hour is, and there is no mandate or requirement that students are in front of screens for 8 hours a day.
Sally, would you like to ask a follow-up?
Yeah, can you also address the assessments? You mentioned that assessments are still are coming back. What does that look like? And what is the oversight that the state intends to follow for both learning standards, distribution of materials, checks for learning progress?
Mm-hmm. This has always been a part of our system, and we actually have state statute that really empowers educators. We have the best teachers in the country in the state of Washington. They are effective and successful at what they do. They do formative assessment along the way. They're evaluating student learning against standards, and they're using it to guide their teaching and their practice, and that doesn't change. We have high expectations they will continue to do that. And what we're pointing out is that, unlike last year where the entire country shut down at one time, we've got a pretty good plan here to restart in an effective way, and that means students and families, I'm looking at you, you need to put in the work as you would in a traditional in-person setting, and that means also being evaluated for the work, turning in assignments, taking your quizzes and assessments and tests. That's the expectation of that, and I know our educators will do great with it. What's also complementing this in terms of your question is the federal government still requires us to do our federally mandated tests, and they suspended those last year for the whole country. They have not offered those waivers this year. So we've tried to make clear to our state that even in a remote learning environment, if nothing changes from the feds, we will be doing our Smarter Balance assessments this year under federal statute. and folks need to be prepared for that. That's a testing window that's usually winter and spring, and so we've got some time to spend thinking a little bit more about that. But at this point, the feds are not waiving that, and so that's what we also mean by we are assessing student learning this year.
Next question comes from Hannah with the Seattle Times.
Hi, thank you for taking my question. I'm wondering why the school reopening guidance isn't incorporated into the 4-part reopening plan, and I'm wondering why at this time the state isn't making mandates as it did in the spring when coronavirus case rates were high.
Well, to your second question, we've learned some things since the spring. We've been able to come up with some additional plans for remote learning, and we've learned some things about this virus. And we believe that this is the right approach for the state's relationship with the local school boards and the local communities for several reasons. Number one, there's been a tradition of local decision-making by local communities where school boards that are democratically elected, just like Chris and I are, they also have responsibility and options, and that this has been a traditional way of making decisions of this nature on a flexible basis. So it's consistent with what we've done in the state of Washington. Second, we think that it gives some appropriate flexibility for school district to school district. One district might have an outbreak at one end of the county, and 70 miles away, they've got no cases. It does give them some flexibility in this regard. And we do have some districts with very low activity that we thought it was not necessary to actually have mandates. Third, there are so many different mixes of how to provide education. It's very difficult for the state to sort of mandate what different smorgasbord of types of remote education that you might have. So by necessity, we thought some flexibility was appropriate. Last, we've tried to make this decision at the right moment, and that means late enough to get the best, most recent epidemiological information, but early enough where it still allows local school boards to consider and make reasoned judgments based on the recommendations from our Department of Health. So for all of those reasons, we think that's the best approach for the state to help local districts. Now, the other thing is we have been asked to do this by many, many local communities, many superintendents, many parents, to provide recommendations. And so that's what we are doing. Now, could that change? Certainly it could change. But at this moment, we think it's the right way forward. I should also note that it appears to be very much consistent with the majority of the will of local communities. The large majority of the communities that have made a decision one way or another have made decisions consistent with our recommendations. So we think that this is basically on the money, on the beam of where these communities are in the state of Washington. Now, I may just want to add too, as far as this local decision making, that's how I got involved in public life, was trying to build a high school in Selah, Washington, a town of about 3,500 at that time. And it was a very local decision, and people pulled together. We hope this helps people pull together.
Hannah, would you like to ask a follow-up?
Could I ask Chris, would you like to add anything to that?
Thank you, Governor. Only to affirm that districts definitely want a framework here, and I would argue it's because they are sometimes crossing multiple county jurisdictions, and they want their local health officials to also have a consistent framework for the way they see this. Again, there's got to be some local nuance to this, but now everyone will have a consistent framework for thinking about low, medium, and high risk.
Basically, I think we're going to get what we would recommend, even without making this a requirement, just to cut to the chase here, because the vast majority of districts that we think are heading in this direction. So this will give us a more unified approach without necessary mandates from the state.
Hannah, would you like to ask a follow-up?
Sure. I'm wondering if you can address the first part of my question, which is why school reopening guidance isn't incorporated into the 4-part reopening plan. I think you maybe got to part of that, but I'm wondering if you can be more specific about why schools aren't directly addressed in that plan.
Well, I'll let Chris answer this on his view, but we just viewed that having a specific schools-based policy, schools have such a unique part in our lives and our families and our communities that we thought it was appropriate to have a specific policy for this particular part of our life. Now, another reason is we have an independently elected superintendent of public instruction, and it's another reason to have a specific policy just for our schools. Chris, you want to add anything?
Yeah, only, again, this is our state's constitutional paramount duty. And so we are hypersensitive right now to trying to figure out maximum flexibility for local boards who are charged by statute in delivering all of the local decisions about this. And so, you know, building a framework was requested by a lot of folks, but also making sure they had the ability and the nuance to do what they thought was appropriate in their community, meets the constitutional obligation, the statutory importance of our locally elected boards, but does it in a way that is not tied to the same sort of adult behaviors of the traditional phases here. It just recognizes that schools are very, very unique in our state from a learning standpoint. They underwrite the economy. They support families who work. It just needs its own set of frameworks here, and I think we have delivered something for districts that will help support their work.
Kathy, did you want to add something?
Yeah, no, nothing to add.
Next question comes from Keith O'Connell. Keith, are you there? We will circle back to Keith. Next question will come from Emery with the Columbia Basin Herald. Emery, we can't hear you. Okay. Come back as well. Next question will come from Carolyn with the South Seattle Emerald.
Hi, can you hear me?
Yes.
Okay, great. So I've been talking with some folks in Seattle's education system here, including a student who said that access to the internet isn't the only barrier to learning that students are facing. They're also facing housing and financial instability, which severely impacts their ability to learn or use the internet and distance learning tools like hotspots they've been provided. Does the state have any plans in the works to work with landlords to provide permanent rent forgiveness, like not kicking the rent can down the road necessarily and allowing it to accumulate until the pandemic is over?
Well, we have, as you know, extended our eviction moratorium for non-payment of rent. We think that'll help significantly. We are waiting to see if Congress will come through with further assistance for the states to see what might be in the realm of all of these things that we'd like to do, including further help for schools. And we are very, very on tenterhooks waiting for that Congress to come through. And there's a host of decisions that could be helpful or not helpful to these families, one of which is the extension of unemployment insurance. As you know, one of the parties, the Republican Party, is resisting extension of unemployment insurance to these families. And that's very important to the group that you're talking about. So we are using our maximum efforts, and I hope everybody here will help to convince the Senate to follow the House and really help out these desperate states, communities, and families and schools. There is certainly more to be done. So I would say that we're very hopeful Congress will come through for us. It appears that there's some cracks in the wall developing in the Republican Party. I just heard this morning that Senator McConnell may be open to the extension of unemployment insurance so that these families that do have to pay rent will have further assistance. We hope that that will be the case.
Carolyn, would you like to ask a follow-up?
Yes, I'm sorry. Please forgive me if I misunderstood, but I don't think that's not exactly the question I asked. What I asked was if the state would be able to, or has plans in the works to work with landlords to provide families rent forgiveness for the foreseeable future, and not just necessarily kick the can down the road, because extending an eviction moratorium is not the same, obviously, as providing rent forgiveness. And with bills piling up and families, and parents losing their jobs and facing housing instability, even as we speak, it creates an extremely difficult environment for children to learn, from what I've been hearing directly from kids themselves.
Well, as I've tried to explain, we have to know to see what Congress is going to do to determine whether we would have the financial wherewithal to make up that rental payments. At the moment, we do not, but we've got to see what Congress does to see if there's some other avenue that is open to us.
Next question comes from Anna with KUOW.
Yeah, hi, Anna Boyko-Iraq with KUOW. So one component that will help schools eventually go back to in-person instruction would be a robust testing and contact tracing system with local health jurisdictions. And right now those systems are facing some delays. Test results are taking some time to come back, and some local health jurisdictions are still using paper for their contact tracing system. What will it take to get those systems operating as effectively as possible, and when do you expect that to happen?
Kathy, do you want to address that issue, and then I'll follow up?
Sure. So first of all, in terms of the testing delays, we actually have some good news to report. We actually pulled our data yesterday of all the tests that had been received over the past week, and the turnaround times have improved quite a lot. And so we were really happy about that. There's, one national lab where we're still seeing significant delays, but, most of the labs reports, I think, on a medium, and the median turnaround time was around 2 days, which has been much improved. So we're very happy about that, because testing is really important to our public health strategy. Continuing to build capacity around the state. There are some new testing, technologies that are coming out that we're really excited about, including some home tests that we're hoping to incorporate into our strategy as well. So that strategy just continues to evolve as the technology evolves. And then in terms of contact tracing, also happy to report that we, do have about a week or two ago, implemented a new system. We call it CREST. It's our electronic system for doing our case and contact investigations. We're in the process of sort of rolling that out throughout the whole state. So definitely making some, great progress there as well.
Yeah, I want to add, we have had contact tracers to do this work because we pre-trained them even before the need existed, and we had National Guards that were ready to do that. In fact, they did do a magnificent job for a considerable period of time. But we've brought in a contractor as well to provide some additional contact tracing assistance as the Guard rotates out. But so we've got tracers, we've got the system. We're glad that we've improved the testing turnaround time, but we need the federal government to continue to increase the manufacture of reagents so that the lab capacity nationally is increased. Because as you know, recently, until this recent improvement, the southern states were having such an explosion in their cases that it has soaked up too much of the analytical capability. We need the federal government to be more active. And by the way, if I can, talk about why that is. Look, I just read today the president said that this virus is going away and that somehow he can just sort of thinking he can wish this virus away. That is such a dangerous attitude, and it so diminishes what we need, which is the federal government to increase the capacity of testing, which you can't do if you think this is just going to go away. So we hope that we'll get some more federal help in this effort.
Yeah, just to follow up on the new contact tracing system and the median turnaround time that Dr. Lofi mentioned. When is the new CREST system going to be rolled out? And for the median turnaround time, is that for samples processed at the national labs as well as the state labs?
Yes, so the testing, we run a testing report every week, and it breaks down the turnaround times for all of the labs that submit specimens to us. And as I mentioned, almost all the labs now are, have a median around 2 days of returning a test result, which has been a great improvement from where we were. And our new electronic case reporting system, or our contact tracing system, was rolled out about maybe 2 weeks ago now. And all of the contact tracers at the Department of Health are using this system, and it's being rolled out to our local health departments as well. And we're in the process of rolling it out to our local health departments.
Next question.
Governor, you shut down the schools to begin with when all this started. Why not use your authority now and make these recommendations mandatory?
I answered that question before, so I'll stand by my previous answer. Is there something you didn't understand about that one, or would you like me to repeat it, or?
I had to.
Happy to do.
If you could, well, I had to sign off and sign on again because of technical
I'm
issues.
sorry. Okay, well, I'll see. Maybe I'll be better this time too. So thanks for the second bite of the apple. Well, listen, it's a serious question, and I appreciate your question for several reasons. Number one, we have had a long tradition in our state, and a democratically established one, sort of constitutionally, of most local decision-making by local communities about the education of our children. Obviously, it's the closest thing to our hearts and our communities. And these decisions largely have been, or significantly left to the local communities and the elected school boards. So I am not the only, and Chris is not the only elected official here. The local school boards have both opportunities and responsibilities. And we think, given the nature of this very unique situation, that it made sense to do what the state can do, which is to provide them the best epidemiological evidence and recommendations. So the second reason is because they have asked us to do it in this fashion. They've asked us to make recommendations from all over the state of Washington, and so we are doing what we've been asked by the local communities. Third, we think that there is so much variability in different communities that it makes sense to have some local decision-making on this. And the reason is, even within, towns that are 70 miles apart, you might have one with a raging epidemic and almost 0 cases in the next school district. So that one-size-fits-all sometimes is very difficult to apply. And also, the nature of the infections can be very different. So you might have a community that has very little infections except in one little congregate setting, in one packing house or in one housing facility. So for all of those reasons, we thought that was the best approach. And I think that it will serve us well. And I also believe that our recommendations, without the necessity of a fiat or a legal requirement, are going to be followed. And the reason I believe that is the vast majority of districts that have decided already are consistent with our recommendation. So I think we're going to have a happy ending here, is that our recommendations are going to be followed by the vast majority of districts without the necessity of a state actual requirement. I think that's a good result, where people have had a good mixture of local control and the expertise of our health district.
I know they're outside your purview, Governor and Superintendent, but what are your thoughts on the fact that some independent private schools are going to go back to school full-time on-site?
I hope they follow recommendations, because the science applies both to public and private schools, and we hope that that will succeed. There is a requirement that they do follow our requirements for social distancing and hygiene and the like, and cohorting. So they are required to follow those if they do attempt on-site instruction. And they'll have to be aware that if there are cases in their schools, they're going to have to make some decisions. And I would point to some things that have happened in some southern states in the last 3 days of schools that have attempted to go back and had rapid infections. So we hope they give our recommendations sound consideration, and we'll go from there.
question comes from Jared with the Everett Herald.
So Governor, I can make sure, just to follow up on the private schools, are you prepared to take action if a private school opens in a high-risk area? If they do what you've just described, it sounds like you're prepared to mandate their closure.
Well, to start with, I want to make sure that there's clarity about this. We have already imposed certain requirements on all schools, including private schools. So they are required to maintain adequate social distancing of their students. And if they cannot do that, because they have too many children in a classroom and not enough square footage, they cannot open legally. So there is a legal requirement on private schools. The same is to be said about hygiene requirements, cleaning, masking requirements. So there are requirements on private schools. And if they cannot meet them, and if they do not comply with them, they cannot legally open. Now, as far as the future, we stand ready, willing, and able to make decisions for the health of our students. And if there are decisions that result in outbreaks, you can anticipate that we could make further requirements from the state or the local health departments as well. So it's something that is often forgotten, but the local health departments have jurisdiction to make decisions by themselves, both for public and private schools. So the local health departments could also make decisions should there be outbreaks in these schools.
Yeah, Keith, this is Chris Rick. I just want to clarify too. The framework that's in place, as the governor has described, is consistent. Both the health metrics that everyone must follow once they are in a facility are true for publics and privates, our charter schools, our tribal compact schools, all of them. They all must follow that. The framework offered here today is consistent across all of those sectors as well. It is local determination with this very strong guidance that has come from experts at health, and we're confident folks will follow that as we've already observed. But as the governor indicated, there are places with very unique circumstances. Even in the same community, a school of 1,000 high school kids is a dramatically higher risk than a school of 20 kids. And so we're giving them the opportunity, public, private, charter, tribal compact, to make those subtle decisions as long as they can follow the health framework and as long as they've considered this larger guidance that is complemented by local health authorities. So remember, every school, regardless of their sector, is also in collaboration right now in coordination with their local public health experts who are walking them through the data. They're the ones who are going to track and monitor this 14-day framework, and they're giving them recommendations along the way as well. So it's really treating everyone equally in terms of the opportunity that they might choose locally.
Sure. And do community colleges and universities, is there a framework in the works for them, or are you comfortable that and let them make their decisions?
We haven't proposed one to date, and I think they're making pretty good decisions to date. So I can't tell you whether we would propose another one. We certainly have not to date.
Next question comes from Laurel with the Spokesman Review.
Hi, Governor. Are you concerned at all that by allowing local districts to decide on their own that we might start to see outbreaks if they choose to open too quickly?
Sure. I mean, yes, we're all concerned about the course of this pandemic. But we also want to respect, as we've indicated, the ability to have some flexibility in their decision-making. And we also believe, as I've said, that this recommendation is going to be followed, and we will be able to achieve our goal of having safer education of our children and a lack of tension between the state and local communities. And that will be a good thing. So that's why I think this course looks like it's headed to success.
Laura, would you like to ask a follow-up?
Yeah. What would have to happen in order for you to end up deciding to close schools again like you did in March? Is there something that you would look for to kind of make that decision at some point?
Well, it would be a combination of things. Obviously, the infection pattern within that individual school, but it would also be in combination of looking in what's going on in the community. Because as I've said, what is happening in the community affects the progress in the school, and what happens in the school is going to affect the progress of the community, because the infection goes both ways. And these young kids can pick up an infection from little Johnny on the playground and then go home and infect their grandparent who gets a mortal disease. So we would look at both of those. We would look at the trends that had occurred recently, and we would look at the R0 number, which is very important in our assessment, and then we'd make a judgment. And I can't tell you specific metrics because there are so many metrics we look at and combinations. And we'd have to make a case-by-case judgment in that regard.
Next question comes from Glenn Kingbeck. Glenn, are you there? We will come back. Next question comes from Alexis with the News Tribune.
I'm wondering for the schools that need it, if the state has any plans to help with PPE costs. Have there been discussions or plans for that?
Well, again, this is one of those things that we're waiting on what the federal government is going to do to the extent of what they make within the realm of the possible of the finances of the state. We have not made a specific proposal to date. We do believe that with the dollars that have gone to schools, that is available for PPE. But if there's additional needs, we're obviously going to listen to those. And again, very hopeful that the federal government can be of assistance to us so that the state can help with those things.
One of the real positives that have come from this, of course, is we've made a commitment to be a more efficient system as a result of this, and just tremendous leadership by the educational service districts who stepped up in bulk purchasing for districts across the state. And so we've got leadership out of the Vancouver area that jumped on this right away. They are in many cases using that initial CARES Act money that went to school districts. That is an allowable use of those federal dollars. They are purchasing gloves, thermal scans, face coverings, cleaning supplies, you name it. If it is about student and staff safety, they've got it on the list. They've worked with vendors and they are ready to go and are already not only receiving, but distributing those to schools. So we figured out a more efficient purchasing system as well. And that's the kind of innovation that's going to have to keep coming out of this opportunity. And I'm really, really proud of our educational service districts. They are in many ways the unsung heroes of our system right now.
Chris, do you recall the total number of CARES money that's gone to school districts already?
Roughly $200 million.
So that money is available for PPE and other needs. It does not mean that all financial needs have been met, but we're not unaware of that.
Alexis, would you like to ask a follow-up?
Yes, the Institute for Disease Modeling had a report about schools and community transmission last month, and it sounded like the next step was going to be a report looking at hybrid schedules. Do you know if they've done that analysis? Are you expecting that soon?
We've had some briefing regarding hybrid possibilities. I'm not sure exactly if you're referring to something different than we've looked at, but I will try to get you more clarity about that, about what we've seen.
We're going to go back and try Glenn from King 5 again. Glenn? Okay. Next question will come from Bridget with Wenatchee World.
Governor, I have two questions. One is, what are parents who have to work supposed to do? Their students if their kids are working, doing their schoolwork remotely. And also, how is the state helping school districts provide support for social emotional learning for students?
Well, first off, I want to compliment our educators who've embraced social emotional learning. It's been extremely effective, and I've been very impressed with what they've done. We hope that they can be creative in remotely providing some of that instruction. I believe it can be done. I've seen the incredible work educators do with young people, teaching children how conflict avoidance about, if Johnny wants the ball and Susie has it, how do they resolve it? I suspect you can actually do that remotely, and I hope that they will find a way to do that and believe that they can do that. So I'll look forward to the tremendous innovation our educators are capable about in that regard. The question about childcare is very, very challenging, And I wish I could say that I have a magic wand to solve all of this problem. But what I can tell you that we've been searching for ways to be helpful. That's why we've made a commitment already, have expended $170 million to help parents with childcare. We've provided stability grants to providers so that providers have the fiscal ability to afford to provide childcare, and that was $29 million. We've authorized full-day care for school-age children to the tune of $14 million. We have waived co-payments through April and June, and we'll be considering future waivers for $10 million. We have an enrollment-based payment March through August of $88 million, and we've increased the rate to pay providers by $31 million. So we've put in about $170 million to help parents with these challenges. But I don't want to pretend to say that this is not going to be challenging for families. And we're going to continue to look for some potential options to help them. And it's challenging because to stand up some new childcare system, within weeks or even months is extremely difficult. But we have to weigh this risk against their children becoming sick and their children infecting their families. And the health of these children and their families has to be a priority decision. And I'm very hopeful that we will find success as we learn further lessons.
Bridget, would you like to ask a follow-up?
Yes, with regard to childcare, are there any of the same kind of restrictions or recommendations for childcare? And if childcare is allowed, why not face-to-face instruction? What's the difference?
Well, there's difference of scale. There's a difference between 2 or 3 children and 150 children having physical interactions in a school. So that's significantly different. As far as the health requirements, Kathy, do you want to talk about requirements of our child care centers right now? We could have, Ross is not here, I don't think, on the phone.
Yeah, the child care requirements are similar to the K through 12 requirements that the Department of Health has worked on with the Department of Children, Youth, and Families. One thing I will say that's different is that, we think that the risk of spread from the really little kids is less than the older kids. And so that is why, we feel comfortable with, kids in childcare. As the governor mentioned, it's often, fairly small groups that are getting together. And it's another reason why in our new guidance around K through 12, we really favor getting those youngest learners back to in-person learning first. Because again, the current science suggests that those younger children are less likely to spread to others than the older children.
And the majority of our children are not in these really large congregate settings. So it's considerably different.
Time for one last question. Final question comes from Katie with the Columbian.
Hi, Governor. I just wanted to address some concerns that I've been hearing from parents in particular who are frustrated that their special education students may not be receiving the services they need in a virtual setting. Of course, compounding that are concerns that some students with disabilities are medically fragile and may be among the most at risk of contracting COVID. So I was hoping you could speak more in detail about the guidance and support that OSPI and the state are providing schools headed into the fall on how to serve special education students.
Well, this is a legitimate concern, and what we've done is build recommendations that take that into consideration, that allow and encourage schools to consider how to provide that face-to-face where it is necessary and where there's another option. And we are encouraging them to work with their staff to find safe ways to do that. And certainly the age and health conditions of educators is something you have to think about in that regard. You have to think about how to minimize exposure to multiple students. You have to think about, as you indicated, some of our disabled children have physical vulnerabilities as well. So our recommendations allow that, encourage it, hope that it will occur, because these children have both a moral and legal obligation to provide them an equitable education. So we hope that these local districts can be creative to create those conditions, and our recommendations are very specific, calling for that.
Caitlin, would you like to ask a follow-up?
Yeah, this is a little bit unrelated, but understanding that local health authorities are the ones that are monitoring this transmission data, I'm just wondering if the state is creating some sort of like central data hub where the public can see what counties are considered high, moderate, and low risk with this framework.
Well, we do, and I'll provide it. We do have a listing of those. In fact, I have it right here. So we will send it around. Those counties have been identified, and it's a pretty unambiguous, definitive definition because we've set it as a numerical criteria. So we will provide that to you.
And I'll also add that the data for incidents is available on our dashboard. It's our county risk assessment dashboard. And we can make sure that we send you the link to this dashboard because this dashboard's updated almost every day, and it has the county rates of cases per 100,000 population per 2-week period.
Yeah, I was just asking if I could put up this list, but we'll send it to you here.
Any final words, Governor?
I want to thank people for what they're doing in the state of Washington. We are masking up all over the state of Washington. We are taking care of our employees and our friends. And today we're considering how to protect our children and our larger communities by making some tough calls that are based on science and the love for our kids. And we recognize that we're going to have to do some extra work and another level of innovation and another level of commitment to provide these children what they need. But we wanted to give communities sound recommendations, and I think we've done this today. And I look forward to all of us as we move forward. So please wash your hands, please mask up, and be well.